All right, let's talk about allergies. If you've ever dealt with them, you know how frustrating they can be. Well, today we're diving into the science behind a really smart tool in that fight, a molecule called Olopatadine. You know the feeling, right? That maddening, gritty itch in your eyes that you just can't satisfy? Or that sudden, nonstop chain of sneezes that comes out of nowhere? It's the absolute misery of allergies, all thanks to tiny little things like pollen and dust. But what if you could shut down that misery before it even gets going? How does a modern, targeted drug actually work on a microscopic level to stop that allergic reaction in its tracks? Well, that's exactly what we're going to find out. So, to really appreciate how a solution like olopatadine works, we first have to get a good look at the problem. Let's break down what's actually happening inside your body when it decides to freak out over a harmless little speck of pollen. Okay, so here's the chain of events. An allergen shows up. Your immune system mistakes it for a major threat and hits the panic button. This triggers special cells called mast cells. You can think of these as tiny little grenades, packed with chemicals. They just explode, releasing a flood of something called histamine. And that histamine is the real troublemaker. It latches onto receptors in your eyes and nose, and bam, that's what causes all the itching, swelling, and sneezing. So if the problem is a cascade, first releasing histamine, and then having that histamine cause symptoms, then the perfect solution would have to fight back on both fronts. And this is exactly where olopatadine comes in as a really smart, modern answer. So what is this stuff? The official definition sounds complicated, but it boils down to something really cool. It's a dual-action agent. That means it's doing two incredibly important jobs at the exact same time. It's blocking the histamine that's already out there, making you miserable, and it's shoring up the very cells that release the histamine to begin with. Think of it like a two-pronged attack. On one side, it's a powerful antihistamine, giving you that fast relief you need right now. But on the other side, it's doing something proactive. It's acting as a mast cell stabilizer to stop future reactions from even happening. And that's the game changer. It's both offense and defense in a single molecule. Relief for now and protection for later. Okay, so let's get into the really fascinating part. How this molecule actually pulls this off inside your body. We'll start with its first job, giving you that immediate relief. The concept here is actually pretty simple. Imagine histamine is a key, and all over your cells, you have these tiny little locks called H1 receptors. When the histamine key slides into the lock, it opens the door to itching and swelling. So what does olopatadine do? It cleverly gets to the lock first and basically jams the keyhole. If the key can't get in, the door to your symptoms stays shut. It's that simple. But just blocking the locks is reactive. Here's the proactive part, its second job. Remember those mast cells? Picture them as tiny fortresses, just packed to the brim with histamine. When an allergen shows up, it makes the fortress walls unstable, causing them to burst open and release everything. Olopatadine's other superpower is that it reinforces the walls of that fortress. It makes them stable so they're much less likely to break open. It stops the problem at the source. And this just puts the whole beautiful picture together. As soon as you use olopatadine, it gets to work. It reinforces the mast cell fortresses so they hold on to their histamine, and it covers up the locks so any stray histamine can't do any damage. The end result? Your symptoms are not only stopped dead in their tracks, but they're also prevented from coming back. So we know the science behind how it works, but now let's talk about the practical side. How is it actually used, and what makes it such a safe choice for so many people? Well, olopatadine is almost always used topically, which just means you apply it directly where the problem is. For your eyes, it comes in eye drops to fight that horrible itching and redness. For your nose, it comes as a nasal spray to go after the sneezing and runny nose. This targeted approach is absolutely key. And why is that so important? Because when you apply it directly, the amount of the drug that gets absorbed into the rest of your body, what scientists call systemic absorption, is very low. And that one simple fact is the secret sauce behind its incredible safety profile. Since the medicine stays local, the side effects tend to stay local too, and they're usually pretty mild and don't last long. With the eye drops, maybe a little stinging right when you put them in. With the nasal spray, some people notice a bitter taste. But the big takeaway here is that serious side effects are, as you can see, extremely rare. Oh, and a quick but really important tip for all you contact lens wearers out there. It's super simple. You just take your lenses out first, put the drops in, and then give it about 10 or 15 minutes before you pop your lenses back in. Easy.
And that very low absorption we talked about, It has another massive benefit. Because so little of the drug actually makes it into your bloodstream, there's an extremely low risk of it messing with any other medications you might be taking. That's a huge plus.
Okay, let's bring it all home. When you pull all of this together, what's the final verdict? What makes olopatadine such a go-to for doctors and patients alike?
It really boils down to these four things. One, its dual action power. It stops and prevents symptoms. Two, it's topical and targeted, so it works right where you need it most. And those first 2 points lead directly to 3 and 4. It has an excellent safety profile with mild local side effects and a super low risk of interacting with other drugs. I mean, it's pretty much the whole package.
And hey, don't just take my word for it. The research itself calls olopatadine a significant advancement in allergic disease management. It's just a great example of how designing a smarter molecule leads to better, safer relief for millions of people.
And that kind of leaves us with a final thought to chew on. We know allergies are becoming more and more common. Treatments like this one show the incredible power of targeted medicine. So it really makes you wonder, what's next? What will the future of allergy treatment look like as our science gets even smarter? Thanks for tuning in.